Hyperemesis gravidarum. According to the American Pregnancy Association, hyperemesis gravidarum is a condition characterized by severe nausea, vomiting, weight loss, and electrolyte disturbance. Currently, the absolute cause is still unknown. It is believed that this severe nausea is caused by a rise in hormone levels. Currently, the most evidence exists for the placenta and appetite hormone GDF-15 as playing the role in the etiology of hyperemesis gravidarum. Genetic evidence also supports a role for the hormone receptors GFRAL and PGR, and for IGF-BP7. Hyperemesis gravidarum has a lengthy list of symptoms and signs that usually appear between 4 to 6 weeks of pregnancy and may peak between 9 to 13 weeks. Most women receive some relief between 14 to 20 weeks, although up to 20% of women may require care for hyperemesis throughout the rest of their pregnancy. Signs and symptoms include severe nausea and vomiting, food aversions, weight loss of 5% or more of pre-pregnancy weight, decrease in urination, dehydration, headaches, confusion, fainting, jaundice, extreme fatigue, low blood pressure, rapid heart rate, loss of skin elasticity, and lastly, secondary anxiety and depression. When comparing signs and symptoms, one can easily confuse morning sickness with hyperemesis gravidarum. However, the key difference is severity. As shown on the chart, vomiting is more severe, nausea lasts for longer periods of time, severe dehydration is present because of vomiting, and lastly, vomiting does not allow you to keep any food down, as opposed to you are able to keep some food down when you just have morning sickness. As for prevalence, majority of women, with the majority being 70 to 80%, experience some type of morning sickness. Recent studies show that at least 60,000 cases of extreme morning sickness, which is hyperemesis gravidarum, are reported by those who are treated in a hospital, but the numbers are expected to be much higher than 60,000 because most women are treated at home or by outpatient care. Therefore, those cases do not get recorded. We will now transition into the management of hyperemesis gravidarum. Mild cases are treated with dietary changes, rest, and antacids. However, more severe cases often require a stay in the hospital. Hospital treatment may include some of the following options listed, such as intravenous fluids to restore hydration, electrolytes, vitamins, and nutrients, tube feeding that can be through the nose to restore nutrients, which is nasogastric, or through the stomach, which requires a surgical procedure to restore nutrients. A stomach insertion of a feeding tube is called a percutaneous endoscopic gastrostomy. Medication can also be given at the hospital. Other treatments may include bed rest, acupressure, as there is a pressure point in your wrist to reduce nausea, herbs such as ginger or peppermint, or homeopathic remedies. Dietary suggestions for management of hyperemesis gravidarum include avoiding strong odors, perhaps letting someone cook food for you instead of you cooking so you do not further induce nausea, eating small frequent meals, drinking fewer fluids, avoiding foods that are high in fat, greasy, or fried, avoiding spicy or sweet foods. Try choosing bland foods such as toast, crackers, pretzels, oatmeal, or skinned breast. You also want to eat easily digested starches like rice, potatoes, noodles, cereal, and bread. As you can see, hyperemesis gravidarum can present a lengthy list of problems. Naturally, one would think, how can I prevent this? Unfortunately, there is no known prevention for hyperemesis gravidarum. Only efforts can be made to combat symptoms. Things such as dietary changes can be made. You can take treatments, medications, or supplements.